The Centers for Medicare and Medicaid keep creating new payment models, new services, and new ways of delivering care. But the problem they're trying to fix hasn't really changed. When you start looking at the healthcare system, specifically Medicare and Medicaid, you'll see that there's actually an entire part of the system dedicated to improving patient care. It's called the Center for Medicare and Medicaid Innovation, and it's part of the Centers for Medicare and Medicaid Services. Their job is to create and test new ways of delivering care and new ways of paying for care. So instead of just continuing with the same systems, they're constantly asking, how do we improve outcomes? How do we reduce costs? And how do we actually take better care of patients over time? And this matters because the current healthcare system, what we call fee for service, was built around office visits. So providers get paid when patients come into the office. They get paid for the visit. They get paid for the procedure. They get paid for what happens during that encounter. But what they didn't get paid for was all the work that was put in beyond the office visit. And that's where the problem is. Because what actually determines whether a patient gets better is not just what happens during that 15-minute visit, it's what happens after they leave. It's whether they take their medication correctly, do they understand their diagnosis, are they able to follow their care plan, is someone checking in on them, and whether their care is being coordinated across providers. For example, a patient with diabetes might come into the office, get their labs done, get their medication adjusted, but if no one follows up with that patient, if no one makes sure they understand their diet, their medication, their blood sugar monitoring, then that patient is at risk of ending up right back in the hospital. So, what the Center for Medicare and Medicaid Innovation has done over time is create dozens of different models, more than 50 models, to try to fix these issues. Some of these models focus on what's called an episode of care. That means instead of paying for every single visit separately, they pay one bundled amount for something like a surgery and the recovery period. So the focus becomes, did the patient actually do well from start to finish? Other models focus on managing a population of patients over time. That means a practice might be responsible for all patients with a certain condition, like diabetes or hypertension, and instead of just treating them when they come in, they're responsible for how those patients are doing over time. So instead of asking, did we see the patient? The question becomes, is the patient's blood pressure improving? Is their A1C improving? Are they staying out of the hospital? When you look at all of these models with different structures and different names, they're all trying to solve the same problem. And that problem is what happens to the patient after they leave the doctor's office. Because this is what we see every day in healthcare. Patients are seeing multiple providers. There's no clear coordination between those providers. Care becomes fragmented. One provider may not know what another provider has already done. The patient is repeating their story over and over again. Information is not always shared the way it should be. And then the patient leaves the visit, and they're expected to manage everything on their own. They're told, take this medication, make lifestyle changes, follow up. But what does lifestyle changes actually mean? Does the patient know what to eat, how to manage stress, how to monitor their condition? Most of the time, they don't. So even though care is being delivered, patients are not being supported. Healthcare is not lacking solutions, it's lacking proper implementation. The solutions don't always get implemented in a way that actually changes outcomes. And a big part of that is because of how the system is structured. Providers are expected to see more patients in less time to generate revenue. So they don't always have the time or the resources to focus on follow up coordination, patient education, even though those are the things that actually improve outcomes. The Centers for Medicare and Medicaid recognize this, and they're paying for care coordination, follow up, patient support, ongoing management. And that's why care management keeps showing up in different forms, because it's designed to support patients between visits. If you're a nurse and you're ready to leverage your nursing expertise, whether that's partnering with providers or building your own care management services, I go deeper into how to actually structure and implement this inside my mentorship.